Here's why you need a legal nurse consultant, because the patient was looking at the medical record and he was looking at the med reconciliation and the facility history of her medications. And he was assuming that those were given to her prior, because that note was written prior to her recovery, that those were given to her prior to that arrest.
Mm.
Turns out the MAR didn't say that. It was actually given after. So I said, I'm sorry to tell you, it definitely was not an anaphylactic reaction related to those medications because she never received them, until afterward. What we ended up doing is I told him, really, I can't tell you anything that you want to hear, unfortunately. But I did go through all 26 items with him and we grouped them into about 5 items. And I said, okay, here's what you have. And I did say, if they didn't communicate to you, for instance, and you left and it caused some sort of an issue with your mom, like maybe you couldn't have, because his point was, I'm the surrogate, so I was supposed to be able to make those decisions and intervene. And I said, okay, so, and there were several communication issues. I said, let's put these all under one item, and what I need you to kind of go find it for me, or not for me. I said, I probably can't help you. You're welcome to come back to me if you have questions, but here's what I think you would need for this. It's a medical review board in their state. I said, you're going to need some sort of specific proof that, because you weren't communicated with, this was not able to be done. And that made my mom, lose out on this or that. Right. Okay. So that's number one. He said, okay, I can do that. The next one, okay, if you're saying that you think a medication was given prior to this point, I need you to go through the record and find specifically where that medication is, that where you think that is, and put that in the packet. Okay, I can do that. So I ended up just sort of giving him a to-do list of items. And frankly, I don't think he'll be able to complete any of them. I don't think they exist, but I told him what he needs, and then he can decide how to go from there. But it's always kind of wacky with the family because they're first of all, they're not usually not nurses, and if they are or they're physicians, it's even worse. All right.